I'm Dr. Agbo Anuga Godfrey. I'm a consultant family physician and I'm the head of accident and emergency at Nisa Premier Hospital, Abuja. Unconsciousness refers to an abnormal state in which a person is not responsive to his environment, because ideally once you talk to a person, he's supposed to respond to you. But in instances where you talk to a person and he doesn't respond, then we actually see the person is unconscious at that particular point. Well, there are various causes of unconsciousness. They could range from permanent conditions and to some that are temporary. So usually we have structural problems, for example, head injury, which could result from accidents, when you have road traffic accidents, for example, or somebody falls from a height. So that could lead to head injury and lead to unconsciousness. But we have other disease conditions too that could lead to unconsciousness. For example, talking about sugar, for those that have high sugar or low sugar level, both of them can contribute to unconsciousness. Then we have other conditions, for example, such as stroke. Stroke also affects the brain and ultimately would also lead to unconsciousness. We also have kidney problems, because when you have kidney problems, the body is not able to clear some of those waste products and they can accumulate and affect the brain. And apart from that, we have electrolytes, all called electrolytes in the body. So most of them, when they are low, for example, calcium and potassium, when they are low too, they can also lead to unconsciousness. So this is just a small list of the various causes of unconsciousness, especially those that are common to us in our environment. So as we said earlier, unconsciousness has to do with the state of responsiveness of a person, somebody not being able to respond. So for example, by the time you're talking to somebody and he's not able to answer you, so that's a warning sign that possibly he's slipping into unconsciousness. So aside that, we also have lightheadedness. Some people might feel lightheaded and drowsy. Those are part of the warning signs. Then we also talk of speech. So they might have slurred speech. They might be talking, might not be able to hear whatever they are saying. So that's also an indicator that this person might be slipping into unconsciousness. So those are the few warning signs that we have. Well, the first thing to do when a patient is, or when a person is unconscious, is to call out to the person. Because it could just, as we say, there could be temporary and permanent causes. So it could just be a temporary thing. So when you call out to the person and is able to respond, because for you to be able to breathe, that means once you're able to respond, that means your breathing is fine. So when the patient is not able to respond, then you could go close to the patient and tap. Usually we tap on the shoulder just to see, are you okay? If you know the person's name, you could call out the person's name to find out if he's fine or not. But if you don't know the name, you could just find out, hello, sir, are you okay? So if he responds, fine. But if he doesn't respond, that means he's unconscious at that point. So from there, you take the next step. If he's breathing, for example, as I said, if he's breathing, then fine, we'll continue. We'll check for the circulation and other aspects that we'll talk of later. Then if it's not breathing, that means we need to give him some form of breathing. So for those that are trained, they are what we call rescue breaths that you can give to the patient. But if you are not trained, some people advocate for mouth to mouth, but these days, because of the advent of infectious disease and other conditions, it's not really encouraged. For those that are trained, there are rescue breaths you could give somebody that is not breathing. So once somebody is bleeding, we need to arrest the bleed. So if you are not in a hospital setting, for example, you find somebody out there, maybe somebody had an accident on the road, we could just locate where the bleeding is coming from, then we could apply pressure there. So if you have maybe bandages around, you could just apply direct pressure and wrap a bandage around. But if you don't have a bandage, you could apply direct pressure with your hands, or if you have a clean cloth around, you could just tie around to secure the bleed. Then for accidents too, where you have massive bleeding, you might be able to tie the limbs, especially if it's the limbs, you're able to tie above the limbs. That's like it using a tourniquet effect just to prevent blood from coming down through the site. CPR is cardiopulmonary resuscitation. It's usually performed when you have an unconscious patient. So CPR is to at least keep the patient alive before you could get medical help, because most people that die because they are not given this first aid treatment. Ideally, in developed countries, almost everybody is supposed to at least be able to perform a CPR, so that at least you're able to save life and keep the patient alive for more when the experts will arrive to take over. So in doing a CPR, we should be able to at least do what we call a compression. That's in doing a cardiac compression, you usually use the palm of your hand in this way. So you usually locate the center of the chest. So you now apply pressure on the chest wall. So usually we give 30 compressions. Then if you're able to give what we call rescue breaths, you give 2 rescue breaths in between the 30 compressions. The whole essence is for those that don't have pulse, because you'll be able to assess when a patient has pulse or not. So for those that you are not able to get pulse, those are the patients that you actually do chest compressions for. But in instances where you have people that are not trained, and you might not be able to detect whether the patient is whether the patient has pulse or not, then it's actually good to just continue giving the chest compressions while awaiting experts to come, so that at least you keep the heart working before the experts will take over. In our environment, we see a lot of people, once somebody goes unconscious, they try to shake the person, they try to pour water on the person. The problem is, for example, if you have a spine injury, by shaking the person, you might not complete whatever. If it's just a partial transection of the spinal cord, you might just complete it and actually cause more problem for the patient. Then also pouring of cold water and all that is not really encouraged. But I know in our environment, we see that's what happens commonly. Then aside that, since the patient is unconscious, he might not be able to coordinate swallowing, so we should not give anything by mouth, ideally. So those are the basic things. Then apart from that, you should not raise, because we see some people raising the head, trying to put a pillow across. But as I said earlier, this might make matters worse. So all these things should not be done in someone that is unconscious. Various complications could arise from being unconscious, as the patient is not able to coordinate. So you could have what we call aspiration. So they'll be able to, whatever comes to the mouth, they may be able to aspirate. Then apart from that, depending on the extent of the damage too, you might have brain injuries, and you might need to permanent disability on the long run. Then also looking at depending on how long the unconsciousness lasts, you might have other complications like infections coming in at long. Then also bed sores could arise, especially if somebody is hospitalized for a very long time. So those are some complications that could occur. Once we have an unconscious patient, all those things we talked about earlier that we should not do, because that's what happens. Because most times, by the time the patient is coming to the hospital, they are already there, because most times, most of these practices we do, we tend to worsen in the patient's condition instead of making it better. So as I said earlier, we should not give anything by mouth, and we should not try to shake the patient. So we should just try and keep the patient as stable as possible and bring to the hospital where we have definitive management.